Hello and welcome to this module on fundamentals of disease intervention, STI contact tracing, and partner services. I am Dr. Nnamdi Moiteke with the Department of Community and Public Health at Idaho State University. So we'll begin with the first unit of the module, which is STI contact tracing. And one might ask, why do we need to intervene in the issue of sexually transmitted infections? We need to intervene because STIs can have substantial impacts on both individuals and the entire public. So sexually transmitted infections can lead to high level of discomfort and health complications, which leads to high morbidity. It can in fact be disabling and can lead to deaths. And so intervening reduces morbidity and mortality from sexually transmitted infections by reducing reinfection and tackling the discomfort, morbidity, and disability that arise from these infections. And of course, ultimately decreasing the spread and prevalence in the community. So what are the goals of contact tracing? COVID-19 led to a heightened awareness about contact tracing and made it more familiar with the public. However, unlike COVID-19 and other infectious diseases where the aim of contact tracing is typically just for infection control, in the area of sexually transmitted infections, contact tracing is actually more of a comprehensive plan which has 5 goals, including preventing new STIs, improving the health of people by reducing adverse outcomes, and accelerating progress in STI research, technology, and innovation. Fourthly, is to reduce STI-related health disparities and health inequities. And last but not least is to achieve integrated, coordinated efforts that address the STI epidemic. So sexually transmitted infections and contact tracing in these diseases have principles, and these include confidentiality and privacy, early detection and diagnosis, collaboration and coordination, and follow-up and monitoring. We'll look at these more in detail now. So as regards confidentiality and privacy, contact tracers must handle personal information, including names, contact details, sexual history, and other details with strict confidentiality. And they should only collect and use this information for the purpose of contact tracing and public health interventions related to STIs. So personal information should be securely stored, transmitted, and accessed only by authorized personnel. Informed consent is also very important. Contact tracers should obtain informed consent from individuals before collecting their personal information or disclosing any details about their STI status to potential contacts. Individuals should be fully informed about the purpose of contact tracing, potential risks, and the measures taken to protect their confidentiality. Anonymous reporting and identification is also very important. So contact tracing programs may offer anonymous reporting options to individuals who want to notify their sexual partners about disclosing their own identity, rather without disclosing their own identity. So these can help reduce potential stigma and encourage more individuals to participate in contact tracing efforts. And so contact tracers should limit the disclosure of personal information to only those individuals who have a legitimate right to know. And this typically includes healthcare providers directly involved in the care and treatment of the infected individuals or their contacts. So contact tracers should avoid unnecessary disclosure, especially to individuals who are not directly involved in providing healthcare or conducting contact tracing. And then there is need for minimization of data collection. Contact tracers should collect only the minimum necessary information required for contact tracing purposes. They should avoid collecting unnecessary personal details. and that are not directly relevant to the contact tracing process. And this helps minimize the potential risk of data breaches or unauthorized access to personal information. And data security and access controls are also important issues in this area. So adequate measures should be in place to ensure the security of personal information collected during contact tracing. And this includes employing encryption techniques, using secure information systems, implementing access controls, and regular monitoring to prevent unauthorized access or data breaches. And very importantly, there is need to comply with legal and regulatory stipulations. So contact tracers must adhere to relevant laws, regulations, and guidelines regarding privacy and data protection. And they should be familiar with local and national legislation pertaining to the collection, storage, and use of personal health information, such as Data Protection Acts or privacy laws. And very importantly, then there's need for more training and awareness. And so contact tracers should receive comprehensive training on confidentiality and privacy practices, including the importance of maintaining confidentiality, procedures for handling personal information, and the ethical considerations involved in contact tracing. So regular updates and awareness campaigns can help ensure that contact tracers remain vigilant about privacy concerns. And also important is retention and disposal of data. So personal information collected during contact tracing should be retained only for as long as is necessary and in accordance with legal requirements. So once the information is no longer needed, it should be securely and permanently disposed of to prevent unauthorized access or unintended disclosures. So we look at the next principle, which is early detection and diagnosis, including access to testing and treatment, and support and counseling. Patient interviews are one of the key important steps in contact tracing. And so when an individual is diagnosed with an STI, contact tracers conduct interviews to gather information about their sexual partners and potential sources of exposure. So these interviews are conducted in a sensitive and confidential manner, creating a safe place for the individual to disclose relevant information. Partner notification based on the information during the interviews, contact tracers work to identify and locate the sexual partners who may have been exposed to the sexually transmitted infection, and they reach out to these partners either directly or indirectly to inform them about the potential exposure and the need for testing and treatment. And we'll deal more on this in the next unit of this module, which will be on partner services. So also important is the referrals to testing services. So contact tracers provide information and resources to individuals who may have been exposed to an STI and guiding them to appropriate testing services. And then they also inform them about available testing options, including local health care providers, clinics, or specialized testing centers. Of course, we also encourage healthcare seeking behavior, particularly for individuals who may be reluctant or face barriers to accessing healthcare. They address concerns, provide information about available resources, and offer support to individuals during the process of seeking medical care. So contact tracers engage in education and risk reduction counseling to raise awareness about STIs, transmission methods, and prevention strategies. And they provide information on safer sexual practices, the importance of regular testing, and the benefits of early diagnosis and treatment. So we need to introduce you to Idaho's reportable disease process, which also encompasses a couple of sexually transmitted infections. And so healthcare providers making a diagnosis are required by law to report to the Idaho Department of Health and Welfare the results of certain sexually transmitted infections which have importance to public health. And in Idaho, these, among the various infectious diseases, the STIs which are included are chancroid, chlamydia, gonorrhea, HIV, and syphilis. So the reports are made to the local public health district or the epidemiology program of the Bureau of Communicable Diseases in the Division of Public Health at the Idaho Department of Health and Welfare. So Idaho's public health districts will investigate disease reports, essentially to identify sources of illness and then to take measures to prevent the spread of these illness to others in the community. And this is where contact tracing comes into play. So contact tracers often are public health and often at public health districts and refer those exposed to testing and treatment by a healthcare provider. And then the Idaho Department of Health and Welfare supports the health districts and coordinates statewide response to infectious diseases and STIs. So who conducts STI contact tracing? Of course, we've already made some allusions to that. So the Idaho statutes for STI contact tracing and partner services stipulates that the authority to conduct STI contact tracing typically lies with the public health authorities, healthcare organizations, and designated healthcare professionals. So contact tracers are individuals who are trained and authorized to carry out the actual contact tracing process. So they may be called disease investigators, or very commonly disease intervention specialists. And they may also be health educators or community health workers. So they may be employed by public health departments or healthcare organizations or contracted specifically for contact tracing purposes. And so contact tracers may be public health professionals, nurses, health educators, or individuals with specific training in STI contact tracing. So contact tracers play a crucial role in improving public health by identifying patterns of disease and implementing interventions to reduce its spread. Of course, a good contact tracer must have certain qualities, certain personal characteristics that make the job go well. So the application of these qualities increases trust. And a primary responsibility of the contact tracer is to establish a strong relationship between the health department and the community to ensure patients receive proper screening and treatment. So therefore, trust between the healthcare provider and the patient, or the health department and the community, is important and can be established through the contact tracer. So some of these qualities include effective and compassionate communication skills, empathy and sensitivity, cultural humility, organizational and time management skills, attention to details, and of course, a high level of professionalism. There are some barriers to contact tracing, and as you can see them listed here, several of them. And so stigma associated with sexually transmitted infections can encourage or can discourage individuals from disclosing their sexual partners or cooperating with contact tracers. And there's the fear of judgment, discrimination, or breaches of confidentiality that may prevent individuals from providing accurate and complete information about their contacts and thereby impeding contact tracing efforts. Limited awareness and understanding of STIs, their transmission, and the importance of contact tracing can lead to lack of cooperation. And so some individuals may not realize the significance of notifying their partners or may underestimate their risk of infection. which can hinder the identification and notification of potentially exposed individuals. So contact tracing relies on individuals accurately recalling and providing accurate information about their sexual contacts. Of course, people may have incomplete or inaccurate knowledge about their partners, especially in cases of casual or anonymous encounters. So these can make it challenging to identify and locate all potentially exposed individuals. So contact tracers may encounter difficulties in reaching individuals who may have been exposed to an STI. So contacts may have changed their contact information, may be difficult to locate, or may not respond to attempts at communication, making it challenging to provide them with necessary information and guidance. Another challenge is that of inadequate access to healthcare facilities and testing services, which can impede contact tracing efforts. So if individuals lack access to affordable and convenient testing, they may not seek medical care or may delay testing, which can delay the initiation of contact tracing and increase the risk of further transmission. Here we have a table with potential ways to overcome some of these barriers that we have mentioned. And so, for example, thinking of stigma and fear of repercussion, and we can go around these by trying to inform cases and giving them adequate information and counseling, actively listening to their concerns and their fears, and of course, discussing adequately the reasons why notification is important and the need to collect certain information to reach out to their contacts. And so working with partners that may provide services that you cannot get is also very important. And here we see also as regards the barrier of lack of awareness and knowledge, and we can overcome these by providing health education and outreach. And with the issue of incomplete or inaccurate information, we can strive to be diligent and carry out timely record keeping, using organized forms and remaining focused on calls are ways we can limit or decrease these barriers. So, of course, legal and ethical considerations. It's important to speak with a supervisor and familiar with local laws. So in your assignment or participation activity, you'll be required to let us know your view on the potential ways to overcome the last three of these barriers on this table. That's resource limitations, social and cultural factors, and resistance to government intervention. So in conclusion, it's important to reemphasize the challenges that can come with contact tracing, particularly in resource-limited settings. And we can go around this by trying to be more innovative in our approaches, and of course, employing collaboration with community organizations. And of course, like we've stated, clients may be distrustful because of concerns about privacy and confidentiality, and certain resistance to government and the healthcare system, and fear of blame and stigma and other repercussions. So, but in the end, the appreciation and gratitude expressed by clients emphasizes or reiterates the importance of providing these essential services and the need to support public health departments and clinics. Thank you very much, and see you in Unit 2.